Koiyan's TikTok.
I then contacted the Loganville police and we spoke for over 30 minutes where I provided them with her Twitter, her TikTok, all her handles.
The Loganville police.
Hey everyone, welcome back to my channel. Today we're diving into a case that has sparked intense discussions online. It's about Lucrecia Kormassa Koiyan, the nurse who went viral for all the wrong reasons. I know you have heard about her, so let's get into it. You may have seen the footage circulating on social media, or maybe you've only heard bits and pieces. Either way, we're taking a deeper look at it, what happened, why it matters, and the lessons we can take from this situation. But before we get into it, you know what to do if you enjoy this video. Now let's get into it. Who is Lucrecia Kormassa Koiyan? She is or was a nurse in Atlanta working in a healthcare facility called SNL, where she was responsible for taking care of patients that are vulnerable. These patients are disabled and depends on caretakers to help them with their daily activities. Now, when we think of nurses, we think of them being compassionate, responsible, and trustworthy. But unfortunately, in this case, social media exposed behavior that deeply troubled many people. What happened? Let's talk about it. Lucrecia recorded herself dancing provocatively over patients in a vulnerable state. This video was shared on TikTok willingly by Lucrecia, and it quickly went viral. Many felt it was inappropriate, unprofessional, and exploitive. She was seen dangling herself over one of the disabled guys. His head was hung down, seems like he couldn't even hold his head up, and was like maybe not talkative. The other guy, he was in a bathtub while she had her legs spread apart, standing over him, dancing again, doing a little whine, and giving him medications. As the footage spread, outrage grew. People demanded answers. Why was this being filmed? Why are patients who are disabled being taken advantage of or being used for entertainment? So this case was brought to the attention of the officers by Accountable Queen on TikTok. What she does is report inappropriate behavior online. She contacted authorities to investigate the 19-year-old Lucrecia. Authorities got involved, and soon after, Lucrecia found herself in deep trouble.
The Queen of Accountability, as she's known on Instagram, is a social media sleuth who tries to provide justice when she sees wrongdoings online. And that's what she saw on Lucrecia Koiyan's TikTok.
I then contacted the Loganville police and we spoke for over 30 minutes where I provided them with her Twitter, her TikTok, all her handles.
The Loganville police put out a statement saying they arrested Koiyan for exploitation of a disabled person.
I was very thankful, but sad at the same time that she's so
legal consequences. Now let's talk about the legal side of this. Lucrecia was arrested and charged with felony exploitation of a disabled person. This is a serious charge and can carry heavy penalties. She may face up to 20 years in jail. Authorities argue that her actions were inappropriate. They also pointed out that Lucrecia violated her patient's rights. According to authorities, the patient is not able to give consent. Although Lucrecia argues that her patient is quite verbal and the angle of the video her audience are seeing is incorrect. Nevertheless, the authorities see this as abuse.
TikTok
is not what it is. All I gotta say for now is angles play a big.
Despite what Lucrecia is saying, the authorities sees this as a form of humiliation. She was supposed to be taking care of this person. Instead, she was fooling around. I must add, during the investigation, they noted no injuries or bruises on the patient. Also, they still haven't provided proof that she is a licensed nurse. This situation raises a lot of important questions. What are the boundaries when it comes to social media? At what point does harmless fun become unethical or even illegal? This case opens up a much bigger conversation about social media, professionalism, especially workplaces like hospital, nursing homes, and schools. On the other hand, social media can be a great place or a great way for healthcare workers to share their experiences, spread awarenesses, and even find support. But we have to be mindful and cautious in people's workspaces. Filming at work is never a great idea. I suggest doing it on break time and not filming the patients. I often see nurses dancing in hallways on equipment. I would hope it's off the clock. Lucrecia is definitely not the only one who has filmed their patient. I've seen nurses dancing with their patients and doing lovable things, but I still think that it shouldn't be done. It crosses on ethical boundaries, privacy matters, dignity, and professional matters. Many argue that she is young but knows right from wrong. Young and old should use their discretion when posting online. Before a post, ask yourself, should I post this? The impact of this video. Cases like this creates a ripple effect. It affects how the world views nurses and caregivers. People voice their opinion on what or shouldn't be done. Families might become reluctant to leave their loved ones in such facilities. They also questioned, should these people be trusted? It can overshadow the hard work done daily by these professions. This is why hospitals and nursing homes have strict policies about phone use and social media. It's about protecting both the patient and the worker. Some things should not be shared online because we may end up in a sticky situation like Lucrecia. We live in an era where going viral and oversharing is the thing, but not everything is to be shared with strangers. When it comes to the workplace, film outside the facility, in the break room, locker room, or at home. Think about the company's policy. Am I breaking the rules? Lucrecia is an example of something that was made for fun, went viral for the wrong reasons. The backlash is something she never anticipated. This incident shows that our actions have consequences. So what do you think? Do you believe that the punishment fits the crime? Was this just a bad decision? Let's discuss this in the comment section. I really think it was a bad decision on her part. I also think that I don't think that she deserved to be in jail for 20 years. That's quite long. I mean, the patients were not harmed, but hopefully, she doesn't do it again. Otherwise, she will probably deserve this 20 years if she does it again. As for the nursing home or the hospital that she worked for, they said they are a caring place and loving place to bring your family members. And rumors are that her mom is the owner of the company. I don't know how true it is, but most articles that I've read said her mom is the owner of the company and that person is not available to speak. Anyway, guys, if you enjoyed this video, don't forget to like, subscribe, and turn on your post notification bell.